And we're now live, Chair.
Thank you very much, Sophie. Thank you for that.
Sophie.
Right, good evening, members, and welcome to the Adults Health and Social Care Scrutiny Board on the Thursday, the 3rd of November. We're nearly at the end of the year. It's sort of going very quickly and it's very dark and very cold. So actually, it's a great advantage of having a Zoom meeting because when we finish this, we'll be all in our comforts of our own home. So thank you everyone for attending. So let's get on with the agenda. So item number 1 is substitutes nominated for this meeting and apologies for absence. We've got apologies from Councillor Shukat and Councillor Ford. And we've got a substitute for Councillor Rivron in replace of Councillor Shukat. I don't think there's anybody else has given any apologies. Okay, so
No,
item
Chair, that's all we've been sent.
Super, thank you, Diane. Members' interest, item number 2, members to remind members to declare any interest they may possibly have throughout the course of the meeting. Item number 3, admission to the public. The public are most welcome to viewers on YouTube, I think. Yes, YouTube. So anyone listening, you are most welcome. I hope you find it's extremely helpful and informative. So item number 4, minutes of the Adults Health and Social Care Scrutiny meeting held on the 6th of October 2022. I move those as a correct record. Can I have a seconder for those? Thank you, Councillor Hutchinson, and all in favour there, please. Okay, superb. Right, item number 5. Always delighted to welcome Marianne, and I've lost you, Julia. Always very much appreciate you coming to our meeting tonight. So item number 5 is Calderdale Safeguarding Adults Board Annual Report 2021 to 2022. Seems like no time at all since last year. So very much welcome back, and you know, we've certainly had a copy of your report, and would welcome any additional comments to the reports, Marianne.
Yeah, I mean, I think I'd just direct you to my comments really on page 35 onwards, where I've reflected on the contributions through all the partners of the Safeguarding Adults Board. Again, 2020-21, as you are fully aware, as the Adult Health and Social Care Scrutiny Board was an exceptional year again for us, keeping people safe throughout the COVID pandemic. But yeah, really proud that it was business as usual for the board, albeit as we are this evening, a lot of our board meetings were online. I've highlighted some highlights throughout the year for you, some of which are still ongoing. For example, the reform of adult social care and wellbeing, the development of that multi-agency front door, so that we actually get the balance right between people in residential care and people living within our communities that have those health and support needs. A good piece of work undertaken and commissioned by the CCG to help inform some of those reforms and proposing a health person within the multi-agency hub. A significant investment from West Yorkshire Police, which was really good to see, despite all the constraints with funding. And again, further investment at Together Housing. We had a good safeguarding week, but I think it's only fair to say that burnt bridges, the impact of the burnt bridges, following through on those recommendations, implementing those new working practices, not just with the statutory partners, but with commission services and with the voluntary sector too, to truly try and make a difference to those people that have multiple and complex needs, some of which are living on our streets. So a lot of work has been surrounded around that, and improving policies and processes, upskilling our staff to rise to those challenges, but still very much work in progress. Obviously, today's presentation is around our annual report. We are doing a piece of scrutiny ourselves on how the recommendations have been implemented, and that's something that we may come back to talk to you. We may wish us to come back to touch you specifically around that in the future. But yeah, we had the peer review team in, and we've discussed that with you before. That went well. Yes, it was a step of faith really on my behalf, but some good feedback from them, some assurances around much of our work, but also some challenges, some new things that we need to concentrate on moving forward. So that's it from me. I'm happy to answer any questions, and clearly I have got representatives from several of the partners here to answer specifically any queries for them. But thank you to Julia really for helping to pull this board report together. So thank you, Julia.
Yeah, thank you, Marianne, and thank you, Julia, for that. And specifically, I did like the highlighted section 8, so that was extremely useful and as a grant. So we've got Councillor Kingston, please.
Thank you very much. I have got a few things that I wanted to inquire into from reading the report. The first, I'd just like to comment on an experience that I had recently that gave me concern in Halifax town centre. I met a homeless chap and had a conversation with him. And there were two things in that event that gave me concern. One was that the police came, there were two police officers walking around, and they came and intervened and talked to him about the Vagrancy Act and want him to move on. I think that I was unhappy with their attitude towards him. It was because it was the day of the proclamation, and they told him that there's this proclamation event going on, and I felt a singular lack of compassion in the way that this man was treated. And the other was that he had a clear health issue. I won't go into details about it. It was evident. He showed me a part of his body, I mean, not an unseemly part of his body, but a part of his body that was clearly needed medical attention, very clear. And I asked him about it, and he said he'd been to the hospital, and I won't use the language he used, but he had been sent away without being examined in a very unseemly manner. He was sent away. So I read all this safeguarding report, and I thought, all well and good, what you're saying, but it sounded, just judging by those experiences, I would say that that messaging is not getting through to the front face of what we're doing. The people that are in the, that are actually meeting the public, that are meeting people in those places, that that trauma-informed approach, it doesn't appear to be being observed. It was my experience. So that was one thing. The second thing, just, it was a very thorough report. Thank you for providing a very thorough report. I did appreciate it. And the other thing was the chart, which showed that compared to our comparators, we've got double the reports of concern compared to our neighbours, and there was no explanation for why that is. So I just wanted to understand, why is that? Why are we seeing double the number of reports compared to our comparators? So those are my comments and questions. Thank you.
Thank you, Councillor Kingston. Marianne, would you like to come in on that first of all?
Yeah, I will. So thank you for your second point, Councillor Kingston. I'd like to come back to you about the first point a little bit. And then I think I have got somebody who's probably better placed to answer question 3 for you, your point 3. But please rest assured that is a question I ask myself, as members of the board, and we are really deliberating on at the moment, and that is an area of concern. So that's not something that's happened overnight. That's been an issue for a long time, but it is something that we're determined to get to the bottom of. And Luke Turnbull from Health, who leads our performance group, will talk to you about that a little bit. So in terms of the experience of the homeless man, I'm really saddened to hear that. I know that we have some really good evidence of things that have improved following burnt bridges. But I too, along with Julia and with Neve, have been out meeting people that are living street-based lives. So we've been to the night shelter, the winter shelter. We've been down to Union Street. We've met with people. We've been to the basement project. So we've been going out and testing out exactly what's happening and what people with lived experience, what their experiences are and what's changed for them. In terms of the attitude of the police officers, I think that's really disappointing. The Vagrancy Act has been repealed, and I know that there is some work ongoing. Obviously, this postdates this annual report to look at how we approach people begging in the centre of Halifax. So there is some work ongoing around that. It's something that was raised with Julia and I very recently, something that we're very mindful of. But I agree, whilst I think the messages have been heard, we need to make sure that they keep being heard, and they're heard by everybody across all of the frontline services, not just safeguarding specialists or managers perhaps. So that's something that we are testing out, and something that we will be discussing further as a board at our development day later this month. In terms of the lack of compassion at the hospital, again, that's something that has been raised with us more recently. And that's really sad. It saddens me, particularly as an individual, but us as a board. That's not in line with our priorities. It's not in line with Vision 2024 for Calderdale as a district. So I think that's something that we will be challenging healthcare professionals on their attitudes, and changing that culture, not seeing these people as a burden, but actually seeing somebody who may be homeless, may have a drug addiction, but equally is a poorly person and needs that treatment. To reassure you though, we do have health practitioners based within the winter shelter now, providing lots of support, including dressing of wounds and those issues. And equally, they have been providing some services directly down at Union Street, but that's something that we need to make sure continues to happen. We take those services to where the need is. So thank you for that feedback, and I will be taking that back to the board. In terms of the referrals, Luke, do you want to come in and talk a little bit about the work that we're doing to try and understand that, and why we think potentially that is an issue, but the further work that we're doing to try and unpick that?
Yeah, I'd be happy to. So just introduce myself. I'm Luke Turnbull. I'm the designated nurse for safeguarding adults at Calderdale Cares Partnership, part of the West Yorkshire Integrated Care Board. As Marianne said, I chair the performance and quality subgroup, and this that we have about double the number of concerns raised, adult safeguarding concerns raised than the national average, is not something that's that new to Calderdale. And I'd like to reassure members that we really don't think this is because we have a lot more abuse happening in our system in Calderdale than in other places. It is something that we've been working on for a little while now, and we think it's more about the thresholds in which we consider safeguarding in Calderdale. So we probably have a lower threshold for what we consider being abuse or neglect in Calderdale, and that's work that's ongoing for a shared partnership understanding of what we mean by safeguarding, what we mean by abuse and neglect, and the threshold and the thresholds for that. Having that number clearly creates issues for us, in that it generates an awful lot of work, and the risk is, of course, that we don't see that we, whilst focusing on everyone, the risk is that we can find it difficult then to pick out which are the really serious safeguarding concerns and need the most attention. And that is a very strong focus now of the board to try and rectify that. Does that kind of help, Councillor Kingston?
Thank you very much. Yes, it does. So it's you think possibly a strong part of the explanation is that our threshold of is of what we consider to constitute abuse or neglect is lower than in the areas that we're being compared against. That makes perfect sense. So I could accept that as an explanation. Yeah, there was one more comment I wanted to make that I forgot to make last time, and it was the stuff on the social media, the amount of impressions and engagements that you'd had during Safeguarding Week. I was really impressed with that. That's really, really healthy numbers. And I wondered how on earth did you achieve that? That I was very impressed. by those numbers? How did you achieve them?
Thank you, Councillor Kingston. I'll bring Julia in now. I'll bring Sean Cook in to respond to the other part of things. So Julia, please go ahead.
Yeah.
Well,
Yeah, with great help from all the different agencies, media or comms teams, basically through Twitter, through Facebook, everyday tweeting, everyday reminding people. So yeah, there was a heck of a lot of content online during that week. And obviously it made the impressions and engagements, which was absolutely magnificent. It's dropped this year, so when you get in the next year's report, you'll see that it's dropped. So we're exploring why that's happened too, but that's a conversation for next year once we've found that out.
Thank you, Julie, for the explanation. Sean, would you like to come in?
Thank you, Chair. By the way, it's Sean this evening. It would have been Kath Gormally, our new Director of Adult Social Care, so she wasn't able to make it, and I'll be presenting the second agenda item. So thank you, everyone. I just wanted to just give a little bit more context as far as Luke's explanation is concerned, because he's absolutely right. If we look at a kind of example of this, quite often, and it is a historical situation in Calderdale, what may constitute or would constitute a quality issue within a residential care home or supported accommodation has been and continues to be reported as a safeguarding issue and as a higher risk than it needs to be. So that's why we've spiked and we're outliers. And exactly as Luke has said, as a system, we are working on that to make sure that the quality issues are being addressed. But we're very clear that they're not safeguarding and that we can start to kind of bring that number down. But it does help in that, you know, we are very aware of that and we kind of scrutinise those numbers on a regular basis. Just in regard of Councillor Kingston's example or experience recently in the town centre. If you can give me any more details, Councillor Kingston, I'll follow that up, because quite rightly, as Marion has said, we are working really hard as a whole set of partners now, partner organisations, the police, SWIFT, ICB, the council, to make sure that we are supporting people who are either living on the street for given reasons and are reluctant to kind of move into accommodation, and we're engaging with them more and more, but we're treating them respectfully as well, wherever we may be supporting them. And there's a lot of work in terms of how we're trying to do that in a more simplified way, so that a person can get to know and trust an officer, wherever it may be. It may be a council colleague, or it may be a clinician, or it could be someone from the homelessness service who can support and guide them into wherever they need to receive help. And certainly not receive that kind of response that you talked about. So if you've got any more details, because I spend quite a lot of time when I can in and around the Halifax town centre speaking to people in those situations to see what their experiences are and how we can kind of support them differently. And I'm encouraging more people to do that. So if you can give me anything more, I'll follow that up and certainly speak to the police and CHFT regarding that situation. So hopefully it doesn't recur again.
That's great. Just one last thing, that the chap in question knew Naomi Cullen and spoke about her as a really lovely person. So he did have a positive experience as well of encounter with Calderdale services. So that was good. Yeah, thank you.
Thank you, Sean, and thank you for coming along this evening. That's you're always welcome, of course. Councillor Barnes.
Thank you, Chair. Before I get on to my questions for Councillor Fenton Glynn, that I preempted so beautifully, I'd like to thank the team for actually a well-written, detailed and comprehensive report, coupled with a short presentation tonight. Spot on. Kudos to the team and the individuals. My comments aren't to Fenton Glynn, but to Councillor Fenton Glynn, but a couple of things. The index of multiple deprivation for community safeguarding concerns, a catchy little number if ever I heard one. I don't think the figures are, I don't think the the outcome is any surprise that where we see the highest numbers are in the more deprived areas. I think what I would like, Chair, is I'd like to potentially in the next year look at some more work on that. I appreciate that this is the first year that they've been able to pull those numbers together, so therefore those numbers might actually be a significant improvement on previous years. We don't know without the trending, but I think it is something that we as a scrutiny committee, I'd like to see a little bit more depth into in future years, and it's good to see that the people around are nodding around the head. The other point is in relation to the data collected by health trusts, and I think those of us who are involved in the joint reconfiguration the reconfiguration of the hospitals have always had some concerns over the fact that part of the business model, shall we say, is based upon more people being looked at within the community, and where we're having issues with discharges is obviously a significant impact upon their business model. Whilst it is good to see that, or good to hear that there have been some improvements, I think I would like to see the Safeguarding Board really push that. I know we are due to do some work on that, on the whole thing of the community care, shall we say, and say, but I think I would like to see that continued by the Safeguarding Board, because without that, the hospital reconfiguration business model doesn't have many legs to stand on. Okay, thank you, Chair.
Thank you, Councillor Barnes. Marion, do you want to come back in on that?
Yeah, no, thank you for that, Councillor Barnes. And yes, you're right, the statistics that we've pulled about the safeguarding concerns in areas of multiple deprivation are a concern to us. And Sean talked about the thresholds that we have, and perhaps we have a lower threshold, but a lot of that's inappropriate when it's in a care setting. I think what we're reluctant to do is to just lift that threshold, because we know that people within our most deprived communities are not coming forward, and that's probably where we need to use our resources most. But yeah, certainly that will be a focus for the board over the rest of this year. And I take your point about keeping a really close watching brief as we move to the IC, or we have moved to the ICS, and making sure that care within communities is accessible to all, and those hospital discharges are appropriately dealt with. So yeah, thank you for raising both of those. But yeah, certainly things very much on our radar as a board.
Thank you very much, Marion. Councillor Pillai, I think you put your hand up at one stage. Just on mute. So did you indicate to yeah, there we go.
It's okay, I'm Councillor Blackburn, it was by mistake.
No, that's okay, I didn't want to miss you out. Right, okay, in that case, Councillor Hutchinson, please.
Thank you, Chair. Again, going back to those figures, are the figures counting the number of individuals or the number of reports, so that one individual may be involved in a number of reports? Because if it's individuals, that equates to 1 in 50 of the population, which seems an incredibly high level. So, and again,
it is incidents or reports, so there could be. I haven't got the figures in front of me, but I would guess that there's a high proportion of reports to a small percentage of people.
Right. Okay. That's clear. And in terms of the indexes of multiple deprivation, and the seemingly more serious or higher proportion of serious concerns in more affluent areas, does that take into account the location of care homes, which are often in large properties within relatively affluent areas, which could skew the picture significantly?
Luke, do you want to come into this?
Do you want me to? Yeah. Do you want me to come into that? So the figures around incidents of multiple deprivation, indices of multiple deprivation, exclude care homes. Right. So this is just community, because we knew that would drastically skew the figures.
Okay, that makes sense. Obviously, the report shows how much good work is being done in bringing organisations together, working across organisations, and in training, which is sort of vital. But safe abuse of different sorts is, as you know, is usually hidden, or attempts are made to hide it. So I was just wondering how we would know whether how effective the board is proving in terms how are we going to gauge whether it's actually doing what we're wanting it to do. And you also refer to I'm pretty sure, but I haven't highlighted it, a couple of reports that are in the pipeline that were due to be produced this year, which I don't believe have actually been published yet. Can you tell us what those are like, what themes those reports are going to be regarding?
Yeah, so take your second point first. There's 2 reports that now have been published. So they are on the website, the learning briefings are on the website, and actually delivered this month. We're taking part in Adult Safeguarding Month in November, and there will be briefing sessions for staff and for everybody, and hopefully that's gone to you too as counsellors, for anybody who can come and attend what the learning is from those 2 reports. So they're on the website, and I can obviously provide the link for the minutes afterwards to make sure that you've got that, Councillor Hutchinson.
Thanks.
Yeah. And the first point, so with regards to training, obviously identifying abuse and neglect is very much a part of our training. Professional curiosity is a part of our training. Not being overly positive with regards to assessments. How we're measuring that, we're actually looking at a new way of measuring the effectiveness of training this year, to ask managers and staff what impact that training has had. We obviously, as a board, collect a number of different data fields. We do audits and we undertake reviews, and all of those then tell us as well how effective we are at spotting and identifying abuse and neglect as well. But I'm not sure whether that answers your question, Colin.
Yeah, it's how do you sort of measure a negative, if you like, are we not seeing it, or are we not looking hard enough?
Yeah.
Or are we being very effective at prevention? And obviously prevention is the ideal.
Yeah, one of the things that we do try and do is at the end of every meeting, board meeting and subgroup, we try and have a horizon scanning. What are the new concerns that are coming up? Are the things that you're starting to see with regards to trends or patterns? Is that particular areas, demographics? So we do really try and do that as at the end of each meeting. Not sure, Marianne and Luke, whether you want to show on.
I mean, ironically, I think the figures tell us that we're receiving more reports than other places in the country. So I suppose people are raising those concerns. I think as a board, we want to make sure that more of those concerns are coming from our most deprived communities, the people that don't probably want to bother us or don't think that there's an issue. So I suppose that's where the work's to be done. One of the areas that we needed to develop following our peer review was really that engagement with the community and voluntary sector, who obviously are able to really promulgate the safeguarding messages much broader than just the statutory agencies. So that's an area of focus. But I think Safeguarding Week, and we're actually doing like a couple of Safeguarding Weeks almost this year, because we're doing a little bit of something around the National Safeguarding Week to really promote those messages, not just to services, but to the members of the public, get some of those messages out. But we can never do too much, I would say. And for every time we manage to raise awareness, you can bet your bottom dollar that somebody will come away with a new and novel way to abuse or exploit someone. Sadly, that's the world that we live in. But I think we've just got to keep going and getting those messages out, and even coming to you at Scrutiny and speaking to local councillors who are picking up on those themes and those trends. in your communities is a really important part of getting that message home. So lots more to do, but in terms of looking at how we perform with our comparators, we are getting the referrals in, so people are aware, but it's perhaps getting the referrals from the right places and the right people and managing it that way.
Thank you.
Thank you, Marianne, as well. Councillor Busnell.
Thank you. And firstly, to echo what everyone else said about a very comprehensive, detailed report. So thank you. Councillor Hutchinson has taken one of my questions. I should learn that he'll always get his hand up before I do. Coming off of some of the things Councillor Kingston said about the figures that seem higher in Calderdale, is one of the things being looked into around that potentially that we do wider training and training of more partners and that voluntary and community sector than other places? And could that be a factor as a way of seeing perhaps a correlation between people who've recently had training and more referrals coming from that area? Secondly, I work as a bartender in Halifax Town Centre, and it's quite common that we will see an individual who we have concerns about, and if we talk to other bartenders across Halifax, it's someone who's known to all of us and a concern to a lot of us as well. We often as a business feel we don't really know where to go with that, so it's not often someone you feel you need to call an ambulance for, or that you want to call the police on, and often it's someone who might have quite a wariness of that. Is it something that's being looked into in terms of, you know, speaking to businesses about how to raise that concern? Because I think a lot maybe just don't know where to go, and particularly as a business that has a lot of people in drinking, I think those concerns can quite often come to the surface. It'd just be good to know that, you know, people do know where to go in that situation.
I think you raised a really good point, Councillor Brundell. I think the part of it is perhaps feeding that information into whatever that information is, but feeding it into the Halifax bit and ensuring that the Halifax bit, you know, communicates with the businesses, and that's my thought process. Sean, do you want to come in back in on that? You've got your hand up.
Yeah, thank you, Councillor Blackburn. It's a really good point, actually. I chair the Making Every Adult Matter. It's a bit of a mouthful, but steering group, and a number of colleagues right across the system are on to, as Marianne has said earlier, really to kind of make sure that following the Burnt Bridges report and recommendations, we are making sure that we've got a system in place where we can identify or hear about, receive referrals about people who are in certain situations of distress. And in fact, I would say honestly that we're probably missing a bit of a trick, because we're working closely with the voluntary sector, the statutory agencies that I mentioned earlier on, but not the business community. And I think it would be worthwhile if we were to probably make contact with the Chamber of Commerce, or understand how we can kind of get our information out, basically a contact number. So when you experience a situation like that, where you want to make a report that isn't police related or health, but someone is distressed, perhaps during the day at least, then, and in the evening as well, if they're inebriated and so on, there could be a contact number. So again, I could follow that up with you, Councillor Brundle.
Thank you, Sean. I think I would equally follow it up with the Halifax bid as well, because actually most of the people are bid payers in the town centre. Julie, do you want to come back in as well? Then I'll bring Councillor River on.
Yeah, I think Councillor Brundell's correct in the fact that the reason we've got so many referrals from care homes is because that message has gone out, and we're more assured of what's going on in care homes in Calderdale. I think the fact that we've done Burnt Bridges and the training and the action that's followed that has meant that the information shared and the safeguarding concerns raised are resulting in more and more referrals and more people being safeguarded. We have just undertaken, as a safeguarding partnership and adult board, a training of all taxi drivers in Calderdale, who we know see vulnerabilities with regards to exploitation, and so what to do. But we've done the more general safeguarding for adults and children. And actually a gap that we've recognised is the nighttime economy, and actually how can we tackle that, where we know other large authorities have whole teams that go out and kind of work with the nighttime economy around safeguarding issues and community safety, and how we can tackle that in Calderdale. I think in the past, we focused on the safeguarding of children, particularly in the nighttime economy, but I think you've just raised a good point there, Councillor Brundle, that actually it needs to be in the round about what needs to be done for children and adults in Calderdale. So I'll take that back with me. Thank you.
Thank you, Julie. Councillor River, welcome to the adults, as always.
And many apologies. I just seem to have a Zoom meltdown for about 25 minutes. No device was letting me in. I mean, Councillor Brundle has made a lot of the point I want to make, but I do want to sort of reiterate that. Perhaps, obviously, awful lot older than her, perhaps seen a lot more of these issues, you know. Sorry, I didn't mean that to sound patronising, but, you know, of people who have alcohol-related illness, substance misuse-related illness, you know, it's very likely to be picked up either in the business sector, like in off licenses or bars, or informally, you know, just in the local neighbourhood. Often people who don't go for help till it's too late, and very often people will be concerned about somebody. They'll know there's a problem, but don't know how they can actually get that support in an informal way. And I think this is something that can very easily slip under the radar. I totally get the point about focusing on children, but a lot of these people will have families, somebody else, they've got their own health issues, and they'll also be impacting on partners, families, and so on. So I do think this is I mean, Councillor Brundle made the point, but I did want to reiterate it again, that this is a long ongoing thing that I think we have seen again and again. Obviously, for example, you shouldn't be serving people who are already intoxicated, but we all know that happens. And also people will be frightened of being threatened themselves. So they will deal with that. So I hope it is something that we can move forward on. Thank you.
Thank you, Councillor River. That's most helpful comments. I think it is to be commended. The report has been definitely to commend this report. To thank you once again for all your hard work. You picked up all the points from last year that we wanted you to pick up and put into the report. It's got meat on the bone. It's of substance. It's always going to be an evolving situation. We acknowledge that. Actually, really, one positive thing that I think you did this year, and that was the peer review. I think that's an excellent thing to have done. You know, highlighting actually where can we improve. So yeah, a massive thanks to Marianne and Julie and the team supporting you. And yeah, and I think we're probably due a catch up, myself and Mike Barnes at some stage, you know, to have an interim catch up and bring something else to this scrutiny. So thank you very much for the report. Extremely easy reading as well. Can I make that point? It was just really easy to read. You know, so absolutely excellent. So thank you for that. You're more than welcome to stay, but I'm sure you have an extremely busy lifestyle. So if you'd like to leave, you're more than welcome to do so. But thank you once again.
Thanks, Councillor.
Thank you, Councillor.
No worries at all. Item number 6, social care reforms, resource implications. So we have Sean instead of the direct, and we equally have the talented Karen Midgley. So welcome, Karen, and welcome, Sean. You provided the report. Do you have anything to add to the report, Sean? You're just on mute, I'm afraid.
Hopefully, in terms of the presentation, it's fairly clearly laid out that these are huge challenges as far as adult social care is concerned. Now, whether or not, depending on what happens on the, I think, 17th of November, as far as the budget is concerned, whether or not the changes outlined in the presentation take place next year, it is kind of, to some extent, academic, in that we will still have to kind of work towards that. And essentially, it is a root and branch kind of review and re-engineering of everything that we do in adult social care services. So it's just to kind of essentially say that as far as the assurance framework is concerned, that is very much about how we practice now. So there'll be a lot more scrutiny in the way that there is in children's services now with Ofsted on how we actually perform, how we present our information, how we deliver services to people. The population will be asked about what they think about our services in much more detail and greater scrutiny than before. And at the same time, we've got the challenge of making sure that we've got the additional resources in place, which is going to be a huge challenge. Firstly, in terms of whether or not we get the additional kind of funding really for the workforce that we will need, both in terms of assessors and backroom staff, to support the greater demand that we're going to receive from self-funders that we will be obliged to assess and support in the way that we do for people that are publicly funded already. And again, as the presentation shows, particularly around the market sustainability plan and fair cost of care, we have more self-funders than we realise, than the government actually realised from the Office of National Statistics. So again, that's going to be a big challenge. And certainly as far as, and I'll bring Karen in a minute, but certainly as far as the sustainability of what is already a fragile market because of the care rate fees, and what they will need to be in the future to sustain that market, and what the government will need to give us to make sure that that is sustainable, is very uncertain at the moment, particularly if there is going to be a postponement of the changes, of the reforms. In addition to that, as I think all members on this meeting are aware, we are also going to rebuild and procure a new case file recording system, so that what we're doing, we can do much more efficiently and be clear in terms of how we report everything that we do for the reasons that I've just outlined. I don't know if you wanted to add anything, Karen, just from a commissioning market perspective.
Yeah, just obviously the presentation's been circulated, but just a little bit of the detail of the fair cost of care. So the fair cost of care exercise covered over 65's older people's care homes in Calderdale and the all-age domiciliary care market, and we engage with those markets to try and get a true and fair understanding of what it costs to deliver care in Calderdale. As Sean's pointed out, that did unearth a larger than anticipated self-funder population, particularly in the care home market. So of the care homes that engaged, around 50% of their residents were self-funding, which is larger than we anticipated. We thought it would be around, I think, 35% from Office of National Statistics figures. The results, I suppose, weren't surprising. It has been done with the ADAS region as well, so we've compared with the region in terms of home care. We came out sort of in the lower section of home care in terms of the gap between our current pay and the fair cost of care. So it was about £2.09, I think, per hour more that the fair cost of care came out. With care homes, probably no surprise to most people, the fees we pay and what came out in the fair cost of care for basic residential were around £250 to £300 short in most cases. Although that being said, a issue we constantly grapple with is the actual cost of care home placements being way in excess of our basic fee rates, and having to use third-party contributions and top-ups in order to bridge that gap. So what we have done is submitted this draft market sustainability plan to the Department of Health and Social Care. Awaiting feedback from that should be November. I think a couple of councils have had some initial queries where data's been missing, so hopefully that suggests Calderdale provided a thorough submission and doesn't have any data missing. That then allows us to allocate that £630,000 roughly that we've got within this financial year, and that we have to account for to DHSC against the fair cost of care. And then we can move forward, and we have to submit then in February 2023 our final fair cost of care plan to Department of Health and Social Care. Obviously, as Sean's pointed out, the longer term funding will be dependent upon the autumn statement as well. So there's a bit of uncertainty now around what that long-term funding was, although there was no guaranteed formula in terms of what councils got for part of this year as the 2 following years. So we're unsure about our long-term funding, which obviously again will inform our plan from 2023 onwards. I think that's probably all I want to say. We did use our sustainability plan, just as a key point really, to underpin the position we've got with extra care as a viable alternative for residential care. We've got Railway Bridge View that opened in the summer, that does provide, I think, a real alternative to residential care, and it's got a dementia specialism. So we have used some of the funding from the plan to support that. It also, for us, I think, highlights the fragility of our residential and nursing care market. A number of authorities have a substantial oversupply. In Calderdale, I don't think we do. We've had 2 homes closed during this period of doing the market sustainability plan. So I think it was a really useful exercise for Calderdale, not only in terms of complying with the DHSC return, but in terms of our thinking around our local market, the current pressures, and what we do moving forwards.
Thank you, Karen. Very, very challenging times ahead. Councillor Fenton Glynn.
Yeah, just to come in quickly on the end of that. I mean, obviously everyone's read the presentation, but the thing that I think is probably worth trying to get across is the 2 things. One is that it's a big piece of work because a lot of things are scheduled to change with the new system, including quite a lot of the quality assurance mechanisms. So you'll see a lot about kind of CQC earlier on in the presentation, and how we have to make sure that we're always prepared for those inspections. So that's been a big piece of work. I'd also say, there's kind of a broader point, is I think there is a ongoing cost to uncertainty. So we've had it hinted that they might be pushing back the charging reform changes, but we don't yet know. At the moment, kind of planning up to March in terms of our sustainability strategy, but we'll probably know later this month whether, what the funding looks like beyond then. We're also having to, in terms of the top-ups, look at a number of cost of living top-ups. So, whether it's heating care homes or making sure that people are in a good position when they come out of hospitals. So there's an ongoing cost to that uncertainty, I think, both in terms of our organisation and everything's going forward. And I think it was quite alarming. I hadn't realised really until I started talking through this. I knew that there were a lot more self-funders than we'd anticipated, but the fact that the government, the ONS figures, suggested that 36% of the people would be self-funded, so people that we'd never come into contact with, and actually it's 50%. So if you think about that in terms of added workload, just for the kind of the straight admin that comes with that, as well as the extra social workers and all those kind of things, you get an idea of the kind of the breadth of changes that we're going to have to get used to and that we're going to have to pick up, which there will be some good elements to that, and there'll be ways that we can scale it up. But actually, that's a big shift in responsibility onto local government, and as we're seeing quite a lot at the moment, there's a lot of shift of responsibility onto local government, and we have to make sure that we do what we can to make sure that those kind of shifts are supported and funded and so forth. But yeah, so that's just a broad little point, just kind of on top of the contributions from Karen and Sean.
Yeah, thank you, Councillor Fenton Glynn. Most helpful. Councillor Barnes.
Thank you, Chair. I think Mayor Andrew said, hoping for the best, prepared for the worst, and unsurprised by anything in between, I think is perhaps a good summation of this report, or the likely future. I think it's page 61, I think, is the one that concerns me the most, which is the one that says current fees no longer reflect the price paid for care, one-to-one costs for additional care are also increasing, and so on and so forth. I think we'd all love a crystal ball. We'd all love to see what the future for social care. I'm very nervous about what's going to happen on November 17th in relation to social care. We all know the system is broken. We all know that it hasn't, that the plans to fix it are years away. And I have some serious concerns that a number of care homes especially if current fees no longer reflect the price, then care homes are going to go under. And I think we need to know what plans are in place if that happens, because we will then be left again picking up the tab, councils that is. So I wonder what plans are in place for that.
Sean Jones come back on that, because it could well be that actually we probably need an interim item in December following the announcement to see what the consequences are of what's announced. I ain't got a clue what's going to be announced. Nobody has.
Yeah, absolutely, Councillor Barnes and Councillor Blabber. We've just finished the process of closing a home that became unviable very recently, and we needed to very sensitively transfer a good number of residents from that home into other homes, which is distressing in itself for them because it's their home. So there's, as you've touched on, really, there is a complete and utter human factor to this. It's not just about the numbers and the finance, of course, that drives the whole system in one way or the other. So it's becoming more and more fragile and problematic, and it's almost like it is a perfect storm in that, as I think I touched on earlier, we have a workforce that's attracted to other parts of the working economy, the local economy, rather than social care services. So it's becoming more problematic to recruit and retain people into the system, while we're thinking in the future about what the additionality looks like and working with all of that demand. Just to add as well, what we noticed when we were working through the closure of this home was the level of high dependency of these residents that would normally have been in a nursing or EME, nursing environment, not necessarily an EME environment. And that was because of the scarcity of those resources in there. And what, again, Karen might want to touch on this, what we're trying to do against this kind of perfect storm or within it, is to make sure that with our annual market position statements that we have to publish as a directorate, to make sure that we're talking about the future and modelling the future in terms of what the needs are out there in the community and how we're going to accommodate those needs. We're kind of working very closely to see what the future will look like and modelling that up. So, for instance, Karen talked about extra care. We'll be building 2 or 3, at least 2 actually, big facilities in Calderdale over the next couple of years in Todmorden and North Halifax. And it's that kind of work that will help us accommodate those with the most complex needs in the most inclusive environments. The other bit, going back to your point, Councillor Barnes, about discharge and hospital and so on, is making sure that we've got enough capacity, good home care capacity. So there's a real focus on that now to make sure that, quite rightly, as we would want, as many people, even with the most complex needs, can reside at home safely and receive that support. But that said, as the last part of the presentation shows, that means that we're going to have to put more money into the hourly rates to make it sustainable for the home care agencies to provide that. So it's not a brilliant answer, I'm afraid, but those are the things that we are focusing on and trying to kind of build a model that will be sustainable in Calderdale.
Thank you, Sean. Councillor Hutchinson.
Thank you, Chair. Can I just check, Sean, that I've got the right end of the stick? From what you're saying, there are people with much higher dependency than you would expect in a residential care home being looked after in this particular residential care home, where there may not have been the expertise and facilities to actually meet those needs. If that's replicated across the borough, then that must be a significant cause for concern. And it is something that I wonder if you've got any handle on. Other question was the assessment for fair cost of care was based on the responses from 13 out of 47 domiciliary providers, and only 8 out of 28 providers of residential or nursing care. Are you fairly confident that that provides a representative sample, or do you think there's much? Do you think it reflects the real picture? Really, that's what I was wanting to question.
Sorry, Karen, go on.
I was going to say I can respond to those points if you like. I think that the particular home that has just closed did have some peculiarities in that it had previously been a nursing home, and it had been deregistered 4 years ago, and in the best interests at the time of some of the residents, they did remain in that home with district nurse and in-reach support, so probably had a higher representation of people with needs that sat outside of the core category of the home. I would say, not to say that there aren't some people in other homes who've got high acuity, but that is one of the particular reasons really that home did have higher dependencies. District nurses were going in there on a regular basis. As part of the closure, we have identified that as a risk in terms of communication and making sure that those people were properly supported. During the last 12 months, we've reviewed our quality procedures, and we've got, rather than just collecting anecdotal evidence, we've got what's called a multidisciplinary spreadsheet approach to quality. So we've got all professionals, safeguarding social workers, the ICB, district nursing professionals, CQC, and our own quality team feeding in so that we've got an overall score of quality concerns, and we're able to weight those and collect an overall picture rather than just having our own quality perspective on homes and then anecdotally bringing together evidence from other parties. And that's given us a better picture, but also developed our relationships with nursing and helped us to look at some of the different systems and risks. And as Sean has said, as part of the closure of this recent home, we are going to do a lessons learned exercise after that and look at, what some of the issues might be and how we can avoid those occurring in other homes across the sector. I just want to go back as well before I go on to the representation around the first point about our fees being much lower than the fair cost of care report. Whilst our basic fees are lower, actually, probably every week, a couple of times a month, I have meetings with care homes, and we're forever negotiating fees and top-ups that reflect actually the cost of care and the needs of residents. So although our base fees on paper look like they're a good distance from the fair cost of care, what we are actually paying providers for individual care is in many instances much closer to the fair cost of care. So we are trying, in addition to our base fee model, to make sure that providers get an adequate fee in order to care appropriately for people. So that was just a point I wanted to pick up previously. In terms of the representation, it wasn't great. We did an exercise over 6 months trying to engage with the market. Some of the tools were very difficult to fill in, which I think put some local providers off. We felt that the domiciliary care, 113 out of 47, was fairly representative because it's a standard contract where we pay a standard hourly rate or a slight enhancement for rural working, and providers are asked to deliver very similar things, so units of care per hour. So that felt like a fair representation. We got some big national companies, some small local ones, and some in between. And we took, rather than an average, we took a median, which was what was advised by Department of Health and Social Care. In terms of the care home market, the 8 out of 28 was more concerning. We got inevitably some of the bigger national companies replying because they have the resources to do it and the central teams. And we got a couple of very specialist dementia nursing and residential care providers whose costs were quite high. By taking the median, that did take out sort of any extremes, so the very expensive and the very cheap. I would say the responses we got perhaps were of homes that were slightly more specialist and slightly higher cost. So I'm not too worried that it left people out and didn't fully reflect the cost of care. I think it probably reflected it a little bit higher than might have been if we'd have got some of our local small providers. And that was probably played out in terms of the regional data, in that, as I said, we were sort of on the lower end of the average across Yorkshire and Humber in our gap for domiciliary care, but our care home provision, our gap was slightly higher, and that's probably a reflection of the fact that we got those bigger national and specialist providers rather than the full cross section.
That's helpful. So, you know, it's also slightly reassuring that you feel that we're not going to see a massive hike in the overall fees, that one way or another there's not such a gap from what we might. Can I just ask one simple, what I hope is a simple question? With the lifetime cap of 86,000 quid, which obviously excludes daily living costs and only includes personal contributions to care costs and only payments made after 2023, whose responsibility is it to keep a running total? Is it the local authorities, or is it the individual themselves?
It'll be the local authorities through care accounts, and perhaps Sean, you want to say a little bit more about the work, because you're a little bit close to that, aren't you, the development of the care account systems?
Yeah, absolutely. Yeah, sure. So it is, yeah, very simply, it will be the responsibility of the local authority. So the new system that we will have, and we'll have to kind of build in some systems within our current system at the moment to make sure that we've got this up and running as soon as possible. We'll have a mechanism in it, basically a meter reading, so that it's plotting the amount of money that the person has spent up to £86,000, and that they can access that at any point in terms of knowing where they are, and we can report that back to them.
Do you have any idea off the top of your head how many people will actually reach that cap before they shuffle off their mortal coil?
No, not at the moment, but that's exactly the piece of work that we've engaged a financial analyst to do. So he started it this week, so we're slightly behind the curve on this, but he started the work this week to model that up to find out exactly what that will mean for the population and for ourselves. So we haven't got that answer yet, but that's exactly what we need to do.
Thank you very much.
Thank you, Sean. Councillor Pillai.
Thank you, Chair. I've sat here and listened with huge patience, and I think I follow on from where Councillor Hutchinson has left, following where Sean has left, and following where Karen has left. I think the underlining word from Karen was trying. I will say now, there's no declaration to declare, as a former homeowner in Calderdale, and that's what brought me to politics. The difficulties that we faced as homeowners and providers was horrendous. I'm taking you all back to the 80s, and it was not very clever. And I've got no sympathy, no forgiveness at this present time for the local authority, the way we were treated as homeowners in Calderdale. You are now left as possibly, I don't know the current figures, 50%. The big boys were brought into Calderdale thinking they were going to give you all the singing and dancing services that you all require. And that didn't materialize, because I went behind the scenes and found out what was going into these large companies. The quality of care was abysmal. And I'm not criticizing, I'm here to say the statement, the reason why I've heard and been patient. And I'll tell you what, we have still not got to the bottom of it. 50% of the local authority homes were closed because they did not fit the standards. 50% of the nursing homes and the residential care homes that I represented as chair were demolished, and they were driven. And I'm afraid to say, I haven't got a good word to say. Sorry, but I've listened patiently. Things have not altered for me. Thank you very much for listening.
Yeah, thank you. And any comments on that, Sean?
Yeah, if I could. I wasn't around during those years, but something that I feel Ian Baines, our previous director, put a lot of energy into was to rebuild those relationships with particularly the care homes. It was his real desire to make sure that we were supporting the residential care home market, particularly through COVID, and all other providers as best as we could. And I will kind of state that I do feel that he did his very best to make sure that we as a directorate were doing the right thing by providers. Totally accept that there were decisions that were made in the past that made the market more fragile, but certainly in terms of developing the roles such as the business relationship managers, and making sure that we were listening and are continuing to listen to providers, particularly when they're getting hit with the amount of demand for discharge to assess beds from the hospital, and how we need to make sure that we support and protect them in that process. I do think there have been real efforts in the last 3, 4, 5 years to improve that situation, but by no means is it perfect.
Thank you, Sean. Well, thank you for the report and presentation. Most helpful. It is challenging times ahead, I'm sure, and I think it would be useful to Sean or somebody to come back at the next scrutiny, just to perhaps just a verbal report might be adequate to say, you know, what's changed since whatever's going to be announced. So thank you. Karen and Sean for presenting that. That was extremely detailed and extremely useful, but not easy reading, I'm afraid. So thank you for that. So item number 7 is the work programme. So over to you, Mike.
Yes, thank you, Chair. Just a few things to mention. The first thing is that last month you appointed to the joint working party with children and young people on the equal care report, Buying Our Care. And that group has met once to do some planning and meets next Friday to get a briefing from Kath, the director, and Sean, I think, as well, about the context of that report. So that's not the scrutiny bit of work, that's a bit of information receiving and intelligence gathering. So that work is underway, and certainly I've discussed with Councillor Blackburn and with Councillor Evans, who's chairing that group, that we ought to have a standing item on this agenda on a monthly basis, so that the work of that working party can be brought into the public arena to update the public on where we get into that, because the evidence gathering will be done in closed sessions probably. So that's the first thing I wanted to mention. The second is that I had a call earlier on today from Ken Barnsley, who some of you may remember from Public Health, who's leading on the Ageing Well work for the council, which is a priority in their health and wellbeing strategy, and he would like to come back at some stage to update you on that. I've told him next month's very busy, but perhaps we could fit that in January or February. Yeah, there's a couple of things mentioned during the discussion today. One was what Councillor Blackburn has just mentioned, which is a quick update on what comes out of the autumn statement in terms of the discussion you've just had, and I'm sure we can build that in either as an item on the agenda or a report to be circulated, because you have got a busy meeting next month. And I think the last thing was to just mention that last week Councillor Blackburn and Councillor Hutchinson were at the Calderdale and Kirklees Joint Health Scrutiny Committee, which was looking at progress on and issues around the around the reconfiguration of the hospitals, and the West Yorkshire Joint Health Scrutiny Committee, which Councillor Blackburn and Councillor Hutchinson are members on, meets on the 29th of November. I think that's everything, Chair.
Thank you. Just for the record, Councillor Barnes was equally there at the meeting, and we all raised some extremely valuable.
And Councillor Pratchard, sorry, and Councillor Pratchard.
And Councillor Pratchard, indeed, absolutely.
I'm sorry.
The danger of them mentioning 1 or 2 people. So
anyone would think, Councillor Blackburn, that Councillor Pratchard and I were quiet in that meeting, and Mr. Lodge forgot us.
Anyone believing that, Mike, would need their head seen to, I'm afraid. Councillor Hutchinson.
Yes, I think it really is important that we can make progress with trying to get an accurate assessment of any progress that is being made in the capacity of out-of-hospital care, and whether the results, there's no doubt that a lot of projects have been set up to try and improve out-of-hospital care, but we've had no sense at all as to whether they're actually delivering the kind of trajectory that is in the modelling for the hospital reconfiguration. And if they're not, then we need to acknowledge that and work with reality rather than fantasy. We're all grown-ups. We need to know what the actual situation is, and then we can try and find a strategy or we can try and encourage a strategy to be developed that actually addresses the real situation. But I've got no sense, I don't think we've received any sense of how out-of-hospital care is contributing to what was previously known as care closer to home, as to whether care is actually taking place closer to home and the impact on the demand for hospital services. And we really need that fairly quickly if we are to consider, if we're going to contribute to the joint scrutiny committee's work.
Yeah, a good point, Councillor Hutchinson. Mike Lodge.
Sorry, I should have mentioned that Bella is tearing her hair out, or has been tearing her hair out, trying to find a date that Councillor Blackburn, Councillor Barnes, Neil Smurthwaite from the ICB, and Anna Basford and Kath and Sean or Sean can meet to discuss exactly what Councillor Hutchinson has just been talking about, which is to get a comprehensive look at community and social care services that impact on depressing or otherwise the demand for hospital care, to fit in with that work for Calderdale and Kirklees, but also the letter that came from Amanda Pritchard, the Chief Executive of the NHS, about additional work that NHS England wants on winter pressures. So we've probably been a little bit sketchy in the work plan, but we are definitely looking at getting both those items to you very quickly. I would say that despite Councillor Blackbur's best efforts next month, I think we might be here slightly longer than 7:15 next month.
Yeah, Bella's next job is herding cats.
So super. Thanks, Mike, and thanks, Bella, for trying to organise all our diaries or controlling our lives. I think you do actually. So I think you've nicely controlling our lives. I think so. Well done. Keep up the good work. Right, we've reached the end of the agenda. So thank you, members, for your valuable contributions. Always useful. Thank you, Sean, once again, and thank you. I think Karen may have left, but great thanks to all her. She's extremely dedicated, and I just wanted to note on the records that whenever she comes to scrutiny, she always gives a very comprehensive response back and assurances that things are going as well as they can be. So I hope everyone has a nice evening, and thank you for attending the adults this evening. So good night.
Night, Chair.
Good night, everyone.
Good Chair. Good night, everybody. Bye.
Hi, Diane. I don't know how we're going to cope with John Ford's appear, then disappears. So I'm not.
Problem with his IT.
Yeah. I think he would just make his apologies anyway.
Yeah.
I think on that one, he apologised to get in, but which is the first. I was quite surprised to see him.
Yeah. Okay, no problem. I'll put his down as apologies for him.
Oh, super. And thanks once again for your wonderful assistance in the background. And
that's no problem.
Yeah, excellent. And I shall see you both soon.
Okay,
thanks, Howard.
Take care. See you later. Bye-bye.
Bye.